Dr. Clay Mechlin. I'm a urologist here in Columbia, Missouri. I'm a member of Urology Associates of Central Missouri, and I specialize in men's health and prosthetic surgery. We not only take care of patients in the surrounding Boone County in Columbia, Missouri, but we see patients all the way up to near the Iowa line, just outside of Kansas City and St. Louis, and as far south as Lake of the Ozarks. So some of these patients drive up to 2 hours to come and see us for their specialized prosthetic urology needs. So I'm originally from Columbia, Missouri. I was born here. I grew up here and went to the University of Missouri for my undergraduate education. I then went to St. Louis, where I did a master's and went to medical school. And then I went to upstate New York for about 6 years, where I did my general surgery internship and urology residency, and did a fellowship in men's health and male reconstructive surgery. Then came back here about 6 to 7 years ago, and I've been here since. So I did my undergraduate education at the University of Missouri with a major in biology. I then went up to St. Louis at St. Louis University, where I did a master's in anatomy and neurobiology and went on to go to medical school there. Then went up to upstate New York, Albany, New York, where I did my general surgery internship and urology residency. I then stayed another year to do a fellowship in men's health and male reconstructive surgery. I came back to Columbia about 7 years ago and have been doing all of the prosthetic surgery for our group since then. So I kind of always knew I wanted to do surgery. It's just a matter of what kind of surgery I wanted to do. And I got the chance to rotate in medical school on the urology service, and I really enjoyed it. I really liked the residents. They were a good group of guys. They had a good sense of humor, but also worked hard. And I came to find that there are so many different little niches in urology, so many different things you can do, from adults to pediatrics, from minimally invasive to reconstructive surgery. You could focus on infertility or men's health or cancer. And so there's just a very diverse array of things you could do and a lot of opportunities. And that's basically why I decided to go into urology. So I do practice some general urology, but I mainly focus on men's health. I do prosthetic surgery, so penile implants, artificial urinary sphincters, and male slings. I also do microsurgery for infertility, things such as vasectomy reversal or varicocele repairs or testicular biopsies and sperm extraction. And I do some reconstructive work as well with urethral stricture disease and also treatments for benign or non-cancerous enlargements of the prostate that may lead to difficulty urinating. I think one of the reasons why I chose men's health is because it has all those different little things that I like to do, like prosthetic urology, reconstructive surgery, infertility. They're all kind of related and intertwined. Low testosterone, erectile dysfunction. A lot of the guys that I take care of, especially in middle-aged to those in their 60s and 70s, have a multitude of these problems. And so they have enlarged prostates, they have erectile dysfunction, they have low testosterone. And we can treat all those things in the individual. And it's basically everything I like to do in one patient. And that's really how I got interested in that. And I also think it's just very important to focus not only on the surgical aspect of it, but also the things that are important for men's health: cardiovascular, diabetes control, normalizing testosterone, good prostate health, and all these things make it rewarding to treat men's health problems. So what I'd like my patients to know about me is that I'm a pretty just normal guy. I like hunting, fishing, outdoors, all things that we can do in Missouri, all things that a lot of the guys that I come in contact have interest in, and we can relate to a lot of those things when we're talking. But I'm also a very hard worker. I'm very particular, type A personality, and I maintain the highest level of discipline and outcomes. And really I'm going to do absolutely everything possible to get you the best surgical outcome there is. And I focus on doing high volume procedures and specializing in a very smaller subset of reconstructive surgeries so that you have good outcomes, because you want to go to that guy that is doing these every week, multiple procedures a day, not just somebody that does it a couple times a year. And I think that's very important.